Welcome back. It is 6:15 this morning. We're taking a closer look at the most vulnerable population to coronavirus. We're talking about the elderly population, those living in assisted living and nursing home facilities.
So what's the picture look like for our veterans living in group homes, long-term facilities? Joining us right now live on the phone, Scott Hurst, who's the Regional Vice President for HMR of Alabama, which oversees 4 of those veterans' homes in Alabama, to include Tut Fan here in Huntsville. Scott, good morning.
Good morning. Thank you for having me.
Thanks for being here. Now, at three of those 4 homes that you oversee, including Tut Fan here, no one has tested positive, we understand. We'll talk about the 4th in just a moment, but what are you doing at those 3 to make sure that they remain safe for both residents and the workers there?
Well, first of all, Pat, we began screening all of our employees and visitors in early March, and that process is still in place now. That's a pretty in-depth screening that everyone has to go through before they enter the building. We began restricting visitation to primary care staff around the middle of March, and that has helped really control the environment there. It's helped us maintain a good, safe environment for the veterans, and I think those efforts are really, really working. We've also done some other things, like we've had the Alabama National Guard in all of our homes assisting us with cleaning. They're scheduled to be at William F. Green this week, and that's the final facility, but that effort and cooperation and coordination between them and the state really was a positive impact on our facility.
Scott, we understand, unfortunately, there were nearly 24 deaths at that Bill Nichols facility down in Alexander City outside of the Birmingham area. How are you continuing to manage that outbreak there, and have you had any new positive cases at that home?
Yeah, we really, it's been a difficult situation, obviously, in any long-term care facility just because of the proximity that everyone is to one another, and they've had a difficult time in that area down there, but I think we've had some successes getting a handle on things. Again, we had the National Guard in there. We've had a couple of other organizations. The Birmingham VA Medical Center sent an infection specialist team in there to give us an assessment, as did the Alabama Department of Public Health, and both of those teams came in April. As of today, actually, this morning, we've got a specialist from the CDC and from Alabama Department of Public Health that's through a special program that they've developed and partnered with. They're going to come in and give us some additional assessment and oversight to make sure that we have good practices in place. So they'll be on site today there at Bill Nichols. So I feel like we're really reaching out to those organizations who can give us the tools and ability to really control what we're dealing with there.
Scott, we've got about 45 seconds with you right now. We understand that you're not taking in any new residents right now. So what's the procedure now going forward for those folks?
Yeah, we're still taking applications, even
Yes.
though we're holding admissions right now. Anyone interested in making applications can go to the Alabama Department of Veterans Affairs website. It's www.va.alabama.gov under their resources tab. You can find the Veteran Services offices, or you can apply under the Benefits and Services tab. So we are still actively accepting. We have waiting lists in every facility, and we hope to be able to come through this very, very soon and resume our admissions process.
Very difficult time for everybody out there. Scott, we appreciate your candor and for coming on this morning. Scott Hurst, the Vice President of HMR of Alabama. Thanks, Scott.
Hey, thanks. God bless.
Time now is 6:19 on your Tuesday morning.
In the Way 31 Storm Tracker